I'm David Garcia, and this is my audience.
Tony.
I'm David.
I'm JR.
I'm Miriam.
Claire.
Susan.
I'm going to talk to you about thyroid cancer today. The thyroid is a gland located in the anterior portion of the neck behind the Adam's apple. It controls many of the physiological functions of the body. The thyroid gland consists of two cells, which both produce hormones. One cell is a thyroid follicle cell, which produces thyroid hormone. The other is a C cell, which produces calcitonin. Abnormal growth of these cells produces cancer. Cancer may cause many disruptions in the normal bodily functions. There are several various types of thyroid cancer. Some are more serious than others. The American Cancer Society states that different cancers develop from each kind of the thyroid cell. The differences are important because they determine the seriousness of the cancer and the type of the treatment needed. There are three types of cancers that develop from the thyroid follicle cell. The most common type is known as papillary carcinoma, which develops and grows very slowly and may spread to the lymph nodes in the neck. Most people do not die from papillary carcinoma. Follicular carcinoma is the next most common type of thyroid cancer. This type of cancer likes to spread to other parts of the body, which makes it a little more dangerous, although most people do not die from it. The third type is known as anaplastic carcinoma. It is a rare form of cancer. It is believed to be caused from a pre-existing papillary carcinoma or follicular carcinoma. This cancer develops quickly and spreads throughout the body and is usually deadly. There's only one type of cancer that develops from the C cell. This cancer is known as medullary carcinoma. This type of cancer spreads to the lymph nodes, lungs, or liver even before the cancer is discovered. There are many risk factors for thyroid cancer: age, diet low in iodine, radiation, and genetics. Thyroid cancer can occur at any age, yet is more likely to occur between the ages of 20 and 60. Women are 3 times more likely to develop thyroid cancer than men. In the U.S., the risk factor for iodine is low because iodine is added into many of our foods, such as table salt. Exposure to large amounts of radiation during adolescence may also lead to the development of thyroid cancer. The American Cancer Society states that doctors have linked 1 in 5 cases of medullary carcinoma to mutations in genes inherited from a parent. There are many treatments for thyroid cancer, and usually depends on the type of thyroid cancer present. The most common treatment is surgery. The tumor is removed, and sometimes part or all of the thyroid is removed. Radioactive iodine treatment is another treatment. Your thyroid gland takes up almost all of the iodine in your body. The radioactive iodine obliterates the thyroid gland and its cancer cells. This is usually used after surgery to destroy the remaining cancer tissues. Once the thyroid is removed, or part of it is removed, your body can no longer produce thyroid hormones. Hormone replacement therapy is used to replace the production of thyroid hormones. Patients also have to have their blood checks every 4 to 6 weeks to make sure the correct amount of hormones is given. Other forms of treatment include external beam radiation and chemotherapy. External beam radiation uses high energy emissions to disrupt cancer cells or slow their growth rate. This treatment is used for cancers that do not take up the radioactive iodine. There are some disadvantages to this method. Nearby cells and tissues may be destroyed. Chemotherapy usually does not work for thyroid cancer. It is usually used if all other methods fail. This treatment uses 2 or more anti-cancer drugs that kills cancer cells and also may kill normal cells. There are a few indications that thyroid cancer may be present: a lump or swelling of the neck, pains in the neck, or changes of voice. To diagnose thyroid cancer, a doctor may use a fine needle aspiration biopsy. It is the easiest way to determine if cancer cells are present. Cells are taken from the thyroid and viewed under a microscope. Other methods to determine diagnosis are MRI, CT, and nuclear medicine scans. All of these help to determine size, location, and if the cancer cells have spread. Thyroid cancer is one of the least deadliest cancers. There are about 37,200 new cases in 2009, resulting in about 1,630 deaths. The 5-year survival rate of thyroid cancer is about 97%. Most thyroid cancer cannot be prevented. However, if you have family history of medullary carcinoma, which is due to genetic mutation, genetic testing would be beneficial. If the genetic tests show that you are at risk, patients may have the option to have the thyroid gland removed to prevent future medullary thyroid cancer.